Welcome back, everyone. I'm John Furrier, host of theCUBE. We are here at theCUBE's NYSE studio. Of course, we have our studio in Palo Alto, California, connecting Silicon Valley and Wall Street, tech and money. Technology is the market, and we are here to bring you all the action as part of our MedTech Unplugged series. This is where we're talking about cyber resilience, talking about all things around medical and now AI and technology helping create a safer but also productive environment. We've got two great guests here. We got some great veterans who are involved in some pretty cool things. John Riggi, National Advisor for Security and Risk at American Hospital Association, and Scott Gee, Deputy National Advisor for Cybersecurity Risk at American Hospital Association. Gentlemen, thank you for coming in.
Thank you, John.
John, 28 years at the FBI for you. You retired. Congratulations. Thank you for your service. Scott, handshake for you. 23 years at the Secret Service.
Yes, sir.
Both very mission-driven projects and assignments. Now you're at the American Hospital Association. A lot going on in healthcare and care. One, cyber attacks is the #1 problem. Hospitals don't have the most sophisticated IT. They're not like JP Morgan Chase, which has a $10 billion IT budget.
Right.
Okay, so a lot of these hospitals have critical systems. They're being attacked. You guys are an industry association looking at this. Ransomware, you don't need to be coming out of left field to know that it's been a real problem.
That's right.
Where are we right now with the adversaries? How vulnerable are we? What's the state of the market?
Yeah. So unfortunately, attacks against hospitals in particular have been increasing pretty dramatically since the last 2020, really. And not coincidentally, they've kind of increased along with the development of the pandemic. So we saw ransomware attacks in particular skyrocket with the onset of the pandemic. And really, again, the attacks mainly come from foreign-based cyber adversaries, both criminal and nation state, primarily from Russia, China, North Korea, and Iran. Yes, they're involved in data theft, basically theft of protected health information. And again, last year, unfortunately, was a pretty good year, but compared to the year before, in 2024, we had the largest healthcare attack in history when Change Healthcare became a victim of ransomware attack. So the healthcare records of 192.7 million Americans were stolen during that attack. But what we're really concerned about is the disruption that occurs and goes along with these attacks. So foreign-based criminal groups, foreign-based nation states, developing these type of attacks, data theft and disruptive attacks.
The sophistication, this isn't a kiddie scripter, this is well-organized mafias, these are well-organized groups. You mentioned nation states, their hands in it. There's ways to get around that. Like I know there's ways to put the finger on them, but the money making involved is significant.
Absolutely.
It's its own economy. Can you explain that? I think most people don't understand in mainstream America that, hey, I got my PC bricked. Can I buy a Bitcoin and give it back? That's happening at scale that is hard to fathom. So scope the problem relative to like the individual who might experience a friend who maybe had their PC bricked or ransomware, to the threat that actually poses, because this is targeted, it's engineered, it's orchestrated, it's an economy, fully funded, operated. Explain that concept, because I think most people don't understand that this has actually been going on for quite some time.
It has. And so again, once the bad guys figured out they could make so much money off this, and one of the reasons that they are able to make such money off this is because they're targeting mission critical, life critical type organizations that provide mission critical and life critical services like hospitals. So if the hospital is not fully prepared to defend against and recover independently, sometimes unfortunately they're forced to pay the ransom. And now we have these groups that are ransomware, known as ransomware as a service. So we have the developer of the ransomware that kind of franchises it out. They have a really interesting business model, and they enable less skilled hackers to conduct these really sophisticated attacks. And
it's like a sales channel.
It is. It's a sales channel.
It's a sales channel.
It's a marketing vertical. Yeah.
They share in the proceeds.
Yeah.
And it's really become big business. This isn't that script kiddie sitting in the basement of his parents' home.
It's not a port scan, the old school days. I mean,
No.
This is basically taking the scalable service and using their maybe spear phishing capabilities to go in and get root access somewhere.
Yeah,
exactly.
Phishing and social engineering attacks are one of the primary attack vectors for this, absolutely.
Okay, talk about the consequences of the hospital, because this is something that affects every person in this country and around the world, but in America it's been targeted. Most people don't understand that the hospital they go to might have some brittle systems, might have some old code, an HVAC system, or some Windows machine that wasn't upgraded or patched, or Linux box. There's always probably an area, maybe, they're not the most, they're focused on caring for people.
Right.
The consequences of the hospital crashing or being taken offline or even disrupted where they have to go to manual process will reduce the care. So that puts lives in danger.
That's right.
That's really the key. Explain that piece of it and some data around that if you have any.
So one of the things that I think we've helped change the conversation in the field about is that helping hospital leaders and hopefully the country, and we certainly help the government understand, when you attack a hospital, conduct a cyber attack against a hospital that results in any delay or disruption of healthcare delivery, those aren't data theft crimes. Those are threat to life crimes. Because what happens is then we have situations, if all the technology is disabled, victims of stroke, heart attack, trauma, radiation oncology, they're being diverted to other hospitals. So whenever you have a delay in urgent treatment, that creates increased risk to the patient. So when we say that, these attacks are not just on the organization, they're on the patients inside the hospital, and really there are attacks on the entire community that depends on the availability of their nearest hospital. John, I've used this phrase in the past in the public, say these aren't just hacking incidents, ransomware attacks, they really are the equivalent of cyber terrorism, because they put at risk entire communities.
Yeah, I would agree with you, and I would concur, and I would amplify that because, again, I've been screaming at the top of my lungs for over a decade on this point, and I say to someone, imagine if the North Koreans floated a helicopter and dropped people in Battery Park, coming down the ropes, fully weaponed up, go to Mount Sinai and start disrupting all the systems.
Right.
Like, what do you think would happen?
Right.
One, we'd mobilize the military.
Right.
There'd be a counterstrike, there'd be it's American soil. But yet the digital penetration has been going on and on for over a decade. Now it's at a level where it's well known, it's not even a public secret. So I always ask the question, why does the private sector have to build their own militia? Because that's what's basically happening. I mean, essentially, they're vertically integrating their own military, AKA cybersecurity.
Yes.
So I don't get it. Why isn't Washington on this? Like, is it lack of education? I mean, I'm a simple person, but if you drop people on our shore,
sure,
that's the red line there. I mean, is there a red line? I guess, where's the red line in digital?
Well, John, you have to look at it sort of historically. The systems we're running on, even if you're running the latest Windows 11, all of the, whatever the latest system is, it's built on legacy technology. And quite often, security was bolted on to that legacy technology rather than built in. So what we encourage hospitals to think about now is security, secure by design. It's CISA initiative. That's really how we solve this problem going forward. Yeah. You're absolutely right. It is a foreign entity interfering with critical infrastructure in this country. So,
is it lineage? Is it more traceability? Is it more just the red line has not been set? I mean, Kevin Mandy and I have had many conversations about this, and there's a lot of brave Americans who are advocating for awareness. Yes. Not necessarily pounding their fist on the table, but kind of in a way. Yeah. But like, I mean, there's no doctrine yet.
Right.
Yeah.
Or is there?
So one of the things I've publicly advocated for over the years on behalf of the AHA and the members is that, look, when it comes to cybersecurity for U.S. critical infrastructure, defense alone is not enough. I've publicly encouraged the federal government, and regardless of administration, to be more proactive and conduct more offensive cyber operations. The U.S. government understands that now, and I'm really pleased to report, especially in the last several months, we've seen an increased tempo of enforcement, operations, and disruptions directed against the foreign adversary. We're hospitals, right? Our job is defense, not offense. and there's only so much we can do.
Yeah, there's almost so much cash. I will say that in the past 2 years, some of these syndicates have not just been broken up, but actually charged. Because when they break them up, they just reconstitute.
That's right.
So, okay, that's a sign. On the hospital side, just more clarification on my side, is that considered critical infrastructure in the eyes of the government? Because
yes.
It is, okay.
Absolutely. That is one of the sectors of critical infrastructure.
Okay, I did not know that. Right. All right, so cool. Hospitals, you got the grid,
right.
DNS probably, servers, GPS. Okay, so where are we now on the Hospital Association as you guys look at this? What's the state of the community? How are they feeling? Obviously, still a lot of threats coming in. What's the state of the art? What's the current situation?
So currently, there's good news and bad news. The good news is hospitals and the leadership are really acutely aware of the elevated risk posed by cyber threat actors, foreign actors. The bad news, part of the bad news, is that the reason we know this is we've been attacked so much.
Yeah.
To your earlier point, John, imagine we average almost 200 attacks a year against healthcare organizations and hospitals. Imagine if there were 200 terrorist attacks a year, physical attacks in the US. As you said, there would be a massive.
Is there any kind of stats on impact on life? I mean, I know there are use cases where people do quote some deaths. Are there any? Do people keep track of that? I'm just curious.
There are. So the issue is that whenever there's a delay in healthcare delivery, especially in urgent situations like heart attack, stroke, and
it's
trauma,
hard to pinpoint.
You always have an elevated risk of a negative outcome. Everyone agrees with that.
Yeah, that's
sometimes it's hard. Like let's say the patient.
To pin it down.
Right. You know, it's a 30-minute delay in the ambulance, but that patient dies 7 months later or 5 months later because they didn't get immediate care. It's hard. But we know that there are some.
Well, they say in a stroke, the first
hour and a half
is mission critical on saving
full
recovery.
Right, that's right. So it's hard to pinpoint, but we do know there are some data out there, some conducted by academic institution, that does show an increase in mortality rate during ransomware attacks for inpatients. And patients that are in the hospital. So we know, look, it's common sense.
Yeah.
If you divert an ambulance carrying a stroke or heart attack patient further away.
All right, so now on the offense, I'm glad there's this movement there. On a more practical basis, what's some of the modernization things going on around resilience? Because obviously you assume, hope for the best, plan for the worst, right? So, okay, what is some of the things that they're doing now that they have enough case data? You get enough working data to know. I mean, the techniques change for sure with the times. Yeah. Obviously, technology gets better. The adversaries get just as much advantage with AI. I mean, my spear phishing messages are getting much better.
Yes.
The grammar is tightened up. I'm sure their success rate's higher.
And you use video and audio deepfakes coming into play now.
Yeah. I'm old enough to know that a URL that says Bank of America that doesn't say bankofamerica.com is not Bank of America. Right. So like, not everyone sees that though because apps kind of mask out these URLs, so it's always coming. Right. What's the best practice? It's got to have a recovery piece.
So I'll just open it up and then turn it over to Scott here for a minute. So what we've helped educate the hospitals based on all this battle experience. We've been attacked probably more than any other sector with real world impacts to patient safety. And we talk about developing plans not just for business continuity, but clinical continuity. How will we care for the patient without the benefit of technology for up to 30 days which is the duration of these attacks. Scott?
Yeah. So you mean like go to like paper or go to process,
paper
go to plan B basically.
Right, how do we do it without technology?
And it requires an awful lot of advanced planning. You can't just say, every hospital, every treatment floor, there's a downtime form. There's a box of forms. When computers go down, this is how you document care. That's a tool. That's not a process. So we work with hospitals to encourage them to think in detail, how do you perform critical services to deliver medical care in the absence of technology, right?
It's almost like a military theater because you know, the young Gen Zs, they don't have the book manual skills. They're used to prompting the LLM.
Unfortunately.
If that goes down, you almost have to have a shadow network ready to go. I'm making this up, but I'm in my mind's eye, I'm like, how are you going to train my 24-year-old daughter who is using tools to go to the old school manual that the more seasoned pros might have?
That's right.
And those more seasoned pros are retiring every day.
Yeah, so, I mean, that's a cultural people process
Training,
technology.
It's an education issue.
So there's a plan B then. You guys see that developing.
There is, but what we're encouraging hospitals to do is really flesh out and go deep on those plans. So not beyond the paper form, how will we actually get an image transferred from a CT scanner to the operating room without what's called the PACS system in the middle, picture archiving communication system in the middle, and develop plans like how will we dispense medications without that cabinet that's internet connected automatically doing it for us. Young clinicians have to figure out how do we calculate drug dosages, watch for drug interactions, allergies, and all of this. They have to start thinking about how we would do this without the benefit of technology.
How many hospitals are in the association? You guys?
We have over 5,000 plus. We have about 85% of all the hospitals in the country.
Is there a gold standard? You don't have to name names without alienating the others, but could you describe what, like a gold standard, or I'm going to say stablecoin standard, that's just to be more crypto friendly. What is the state of the art? If you could look at, okay, that's the right way to go. This is the cutting edge. They're pushing the envelope. Got compliance. They got operation, continuity plans. Is there a playbook?
We have a lot of hospitals that are making great strides. They are thinking through the process and documenting what it would take to actually perform critical functions without technology. Some hospitals aren't quite there, to be honest, but everybody's aware of it. We're getting the word out, and folks are thinking in the right direction. So
I have to ask this question for you guys because it's more of an observation on my side. There's a lot of young people I interview and also I've interfaced with. There's so much passion around healthcare these days.
All right.
A lot of people want a better system. I mean, you ask anyone, can healthcare be improved? Is there a way for someone to get involved with your mission? Is there a organization? How do people get involved, and if directly or indirectly? Sure. What could people do to either get the word out, to help understand one of the challenges, the constraints, the workflows? I mean, AI has got entrepreneurial opportunity too. There's a lot of private sector activity. I mean, I saw an entrepreneur in the finance side come out of Goldman. Now he's got a whole credit thing. He's going supernova. Essentially, I know credit from working at Goldman Sachs. So I think there's going to be a lot of entrepreneurial activity.
There's a lot of opportunity in this area as well. So we can't rely on the government to bring us solutions. One, the government doesn't have the money to fund a lot of what's needed in healthcare. We see cuts coming forward for Medicaid cuts, expiration of ACA subsidies. All that will impact the budgets available for hospitals to devote to cybersecurity. So not only are they facing this foreign adversary threat, but we face a domestic financial threat as well that hinders our ability. So get folks involved by understanding, if you're in healthcare, that technology is part of your job, and wherever there's technology, you have to think about cybersecurity, and really understanding that cyber hygiene is as important as medical hygiene to protect the patients. So get involved, think about cyber right from the beginning.
Well, I really appreciate what you guys are doing. I love the mission. Personal question to kind of wrap up the segment. 28 years, 23 years, great service to our country.
Thank you.
If you had a magic wand, each have to answer this question. If you had a magic wand and can just be like, okay, solve the problem. I mean, within attainability, what would the ideal solution be to fix this mess we're in? The cyber threat and preservation of institutional healthcare as critical infrastructure, steady state, things are moving great. What would be?
It's easy. All possible with money and manpower. That's all we need. More money, more people. Things we've talked about already. The security, secure by design, like software that is more secure, better secure, easier to maintain. And then John's already touched on the offensive cyber. We have to make it undesirable to attack America's hospitals.
We, and ultimately, look, my magic wand is, I'm not going to ask for a complete cure, but like if we can reduce the risk, like reduce it pretty significantly, partnerships, private sector partnership with the government, with healthcare, leverage our collective expertise for the common good and the common defense. And we're already doing that we have certain projects going on already with the government.
So more harmony amongst the stakeholders that have the most domain expertise.
Exactly, let's leverage the expertise that we have. We were able to work with Microsoft, for example, to develop and deliver free and heavily discounted cybersecurity services from Microsoft for rural hospitals, or hospitals that are in most need, at no expense to the taxpayer.
Yeah.
And it just got, all that took is get the right people in the room, from us, the private sector, and the government.
You know, with all the AI productivity coming down the pike and margin, there could be a nice opportunity to see some private sector contribution, participation, collaboration. I'm still bullish on opportunity recognition for an entrepreneur because, you know, there's use cases now you can keep your cost structures really low and still make money.
That's right.
At the levels well below
they're
having now. So, gentlemen, I really appreciate it again. Thanks for coming on theCUBE. This is a really important segment. I think getting the word out that it is not as rosy out there, and it's hard on the hospitals, and that they're trying to be there for us, and it's critical infrastructure.
Thank you, John. Thanks for the opportunity.
Thank you, John.
Okay, I'm John Furrier, host of theCUBE, bringing you all the action. Cyber resilience, it's a holistic picture, it's an operating system, it's a network effect, it's about secure software and about using technology for the better good to protect and serve our people in the country, and this is an important mission that we're going to see more and more. Ransomware is just the tip of the iceberg. It's a signal to what could happen at much greater scale. Again, we're watching it, we got pros on it. Thanks for watching.